First year MBBS exam. The examiner looks at you and says, tell me the surfaces, lobes and zones of the prostate. Most medical students panic here. Let's fix that in 3 minutes. How many surfaces does the prostate have? The answer is 4. Anterior, posterior and 2 inferolateral surfaces. The anterior surface is pierced by the urethra in the lower border. The posterior surface is pierced by the ejaculatory duct in the upper border. The base is continuous with the neck of the urinary bladder, and the inferolateral surfaces are related to the pelvic side walls. Next Viva question. How many lobes does the prostate have? The answer is 5. Anterior, posterior, median, right lateral and left lateral. 2 important points here. The posterior lobe, which lies behind the ejaculatory duct, is the most common site for carcinoma, and the median lobe, which lies between the urethra and the ejaculatory duct, is the most common site for benign prostatic hyperplasia. Functionally, today we talk of lobes being as 2 lateral lobes and 1 median lobe. And the last Viva question, how many zones does the prostate have? Modern anatomy doesn't focus much on lobes. Instead, they focus more on McNeil's zones of the prostate. And there are 4 zones of McNeil. They are the peripheral zone, the central zone, the transitional zone and the anterior fibromuscular stroma. First among them is the peripheral zone, which is a cup-shaped posterior part of the prostate. 70% of the adenocarcinoma come from here. The central zone is the one which surrounds the ejaculatory duct. Though this zone is adjacent to the peripheral zone, it is relatively carcinoma resistant. Transitional zone is the periurethral zone, and this zone is the one where BPH is commonly seen. And anterior fibromuscular stroma is a non-glandular area, and so carcinomas are rarely seen here. So remember this for your Viva. 4 surfaces, 5 lobes and 4 McNeil zones. And 2 important questions. Peripheral zone is where carcinoma is seen, and transitional zone is where benign prostatic hyperplasia is seen. If this helped you in your Viva preparation, follow the surgical mind.